Hello, 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 Facebook. I am Dr. Myla Bennett of Adara Plastic Surgery and Medical Spa in Johns Creek, Georgia. And I am coming on tonight to talk about plastic surgery after weight loss. Hello, Cherie. Hi, Tommy. Hello, hello, hello. Hi, Shamika. You all, if you could do me a favor and share the video and let people know that I'm on tonight. Hi, Courtney from Arkansas. Shakira Holt, how you doing? How you doing? Share the video and let people know that I'm on. Hey, Toya. Hi, Sherry. Hey, Sharon. Are you on vacation yet? Hi, Sharon. Sharon, you missed our I was just like a spectator on the live feed, but Ebony from EPI Media Group and Dr. Sonia were doing a epic takeover, talking about her journey in becoming an entrepreneur. And I was like, where's Sharon? I was surprised you weren't on there. I shared the video to my page because I know a lot of my followers are into business and entrepreneurship and stuff like that. And I was looking for Sharon to be on there, and you weren't on there, girl. Go and check the replay of it. It was pretty good. And if you all haven't registered or heard about the conference, the Epic Conference is going to be in October, and I'm one of the speakers there. But there is like a lineup that is phenomenal of documented millionaires that are all going to be gracing the stage to teach you the things that they've gone through to become who they are now, and how they got their business off the ground. And everybody's got a story that is phenomenal. Nothing was handed to anybody. Everybody had to like invest in themselves, take risks, be scared, all that stuff. So it's people that you can learn from if it's something that you want to do and you're not sure how to do it or you're afraid to do it. It's a lineup that is phenomenal. The conference is it's October, I think it's like October 26th, 27th. But to check out the lineup and the information about the conference, you can go to www.theepiconference.com and get your ticket or just learn about the conference. So anyway, for all of you who caught my Facebook Live earlier, I got a treatment done on my face called the intensive. So you can kind of see what my face looks like now. You can see I got a little bit of I wouldn't really call it bruising. It looks like little abrasions under my eyes, but we went hard on my eyes. Like I had her go over that a couple times because I got little bags that I'm trying to get rid of. So you guys will get to see my face evolution over the next couple weeks. But this is what I look like the day of the treatment. You can't really see the grid marks yet. Usually when I get grid marks, they show up like tomorrow. It'll show up like tomorrow if I'm going to get them. But so far you can't see them. You can only just see this stuff underneath my eyes. But so just just follow my face. I love that treatment too because so what I got was radio frequency and microneedling combination. So the needles, when they pierce your skin, radio frequency energy surges through the needles and treats the undersurface of your skin, treats your dermis, and it induces collagen growth, and it tightens your skin, and it fills in fine lines, pores. It'll tighten up these little bags I got. It'll tighten those up, and I love. It's one of my favorite treatments, but it hurts. Some people it doesn't hurt, but for me it hurts even with the numbing. So I numbed my face for like 30 minutes before I got the treatment, and I used a different numbing cream, and I really liked it because it actually was a lot more tolerable than it normally is. Tommy, you already look 18, honey. So this is what I look like. I had the treatment at like 2 o'clock. What time is it? 10? So this is what I look like 8 hours later. It's not too bad. If you wear makeup, you can put makeup over it, and nobody would even know you had anything done. Meanwhile, you'll start aging backwards right after the treatment. And I can feel tingling underneath. Not bad tingling, but like something is happening that's another reason why I love the treatment, because you can feel it. It's like you can feel the action happening underneath your skin after the treatment. It's so fabulous. Yes, it will help the parentheses. You'll see. Watch my face for the next couple weeks. Yes. So the topic tonight, I'm glad you brought up the weight loss thing. Topic tonight, how much extra is it to do the neck? An extra $250 to add the neck on. So the topic that I wanted to talk about tonight was plastic surgery after weight loss, and Shamika just brought up a very good point. When people lose a lot of weight, or even if you just lose some weight, when you hit your 40s and 50s, when you lose weight, it really shows in your face. If you're like 18 years old and lose a bunch of weight, people's faces still tend to hold up. But once you get like late 30s, 40s, and you lose a lot of weight, it really affects your face. So now you'll see, if you notice, like a lot of really thin women, and that's not that they lost a bunch of weight, but just naturally thin women, they'll have like these insanely beautiful bodies, but their faces will look old. So their body might look like they're 20 and their face might look like it's 60 and the lady's 40. When you get older, and you lose weight, you lose volume in the face. And a youthful face, even on a skinny person, a young person that's thin still has a face with fat in it. Like, they still have volume in their face. So when people lose a lot of weight, like say they lose 100 pounds, 200 pounds, they tend to look much older than they actually are after they lose the weight, because they also lose fat in their face. So it's very common for people who have lost a lot of weight to come in, and that's a situation where like somebody in their 30s might actually be a candidate for a facelift, when usually facelifts are done on somebody that's like 60 or 70 years old. But if somebody's lost a lot of weight and their face is dropped, they might need a facelift. But some of the other treatments that people can do, especially now where we have all this advancements in technology to allow for some pretty dramatic improvement without surgery. The treatment I did today is a perfect example of that. So that would be something that I would definitely use on a person who's lost weight, who may have laxity in the skin of their face, laxity in their neck. It helps with that. The other thing that I think is really useful in a person who has diffuse volume loss in their face is a filler that's called Sculptra. It's L-polylactic acid, and it basically, when it's injected into your skin, it causes you to lay down more of your own collagen. So it's not a filler like the other ones where you put the filler in and the filler itself, like the hyaluronic acid, is sitting there bulking you up. With this product, when you inject it, you bulk yourself up. It incites a reaction that makes you lay down more of your own stuff. So it looks really, really natural, and it lasts you for several years once you get corrected. That's one of the things that I really like to use on weight loss patients, to make their face look more like their real age, instead of them looking like much older than they actually are after they lost the volume in their face from losing weight. So from a non-surgical standpoint, you can do treatments that will tighten your skin. You can do treatments that will induce collagen growth in your skin, or you could just get filler, which will just plump up the area that is deficient. And then the step further is obviously surgery in the form of facelift, neck lift, cheek lift, eyelid lift, brow lift. Like, any of that stuff can be put back to where it belongs if you've lost a lot of weight. And obviously, I'm a proponent of people being on good skincare. That always makes everything better too. But if you've lost a lot of volume in your face, skincare is just going to make your skin look better, but it won't restore volume in your face. So, from as far as the body goes, a few of the really common surgeries that people inquire about after they've lost a lot of weight, obviously, would be tummy tucks, which they'll have excess skin and maybe some excess fat left on their abdomen hanging. They'll have an apron of skin on their lower abdomen hanging, and maybe they have two aprons, and they want their belly to be smooth and flat and without the excess skin flapping, and a lot of times they'll get rashes underneath in the apron and stuff like that. So tummy tucks, I would say, is probably the most common procedure that's done on massive weight loss patients to restore their abdomen. And the tummy tuck for a massive weight loss patient might be a more extended version of the basic tummy tuck surgery, meaning you might end up with 2 incisions, one up and down and one going side to side, if you're a massive weight loss patient, because you might have excess skin in both dimensions, like this way and this way. So that's called a fleur-de-lis abdominoplasty. And obviously it's not ideal to have an incision going up and down your abdomen, because you can't really hide that if you're trying to like wear a bikini. But if you have excess in this direction and that's not pulled in, then it'll make your shape look a lot more boxy than it has to, and not be able to get it as flat and smooth. So some people just need to have that. So it's better to get the right shape and contour than to try to avoid the extra incision. But some people are like, I still don't want that incision. If that's the case, pulling it down is better than nothing. Pulling it this way is better than nothing. But for a lot of people who've lost a couple 100 pounds, they need this incision and this incision in their tummy tuck. Another variation of the tummy tuck that massive weight loss patients tend to get is what's called a circumferential body lift. So it's like a tummy tuck in the front and a tummy tuck in the back. And that'll help lift their butt, because a lot of times when people lose a whole lot of weight, their butt will be really, really saggy, and the skin will be like hanging. And so that's lifted by excising the excess skin, and they'll have an incision on their back that's kind of going across. That's not the same as a Brazilian butt lift. A Brazilian butt lift is liposuction and using that fat from the liposuction and transferring it into the butt. And sometimes people get both things depending on how severe their issues are. Because if the skin is all messed up, you can definitely fill the skin envelope with fat, but it still might be too much, like too much skin. You still might have to cut some away. So those are kind of some of the options. It just depends on the quality of the person's skin, how much extra skin they have, how much fat they have to donate. Because if they've lost a bunch of weight and they don't have a lot of fat, it's really just skin, they can't really do that anyway. The other thing we do is use the skin that we want to cut away to augment the butt. So it's almost like, not almost, we cut it on one side but not the other side, and actually fold it down and use that flap that we fold down to make the butt bigger. So that's one of the tricks we use for massive weight loss patients, to get rid of the skin and use that skin to fill the space and make the butt more voluminous. So then there's the arms. Before arms, let's stick with the trunk first. So the other thing is breasts. So a lot of times when you lose a bunch of weight, the breasts turn into flapjacks. The nipples will kind of go inward. So instead of the nipple being like in the middle of the breast mound, even if it's pointed downward, it should still kind of be in the center. But one of the things that tends to happen with weight loss patients, massive weight loss patients, is the nipple will medialize, meaning it goes toward the midline. And then they have a lot of lateral boob, but it's all flattened out. So a lot of times it's not enough breast tissue in there to actually reduce it, even though their breast might be practically down on their lap, because it's skin. It's not so much fat since they lost a bunch of weight. So they that often won't be covered by insurance, because breast reductions are covered by insurance. But in massive weight loss patients, if it's really just a bunch of skin, they can't get that covered by insurance. So it's considered a lift, not a reduction. But the breast will be lifted up, put back where it belongs, and oftentimes you'll need a breast implant in addition to the lift in order to make them look round and perky. Then going from the breast is to the arms. So those wings that people may have after they lose a lot of weight in their arms, the surefire way to get rid of that excess skin is excising it. But the downside to that is you end up with a scar that you can't really hide. So like with the tummy tuck, the scar is hidden underneath your underwear. But with the arm surgery, with the arm lift, you have an incision that's running like on this inside part of your arm, like from your axilla to your elbow. And you can't really hide that if you put your arms up. If you have on a tank top and you put your arms up, people will be able to see it. but it will make it so that you have a nice smooth arm, and you can put on shirts and not be worried about having too much girth from the extra skin and stuff to be able to pull a sleeve over it. So a lot of women who have a lot of excess skin on their arms, they think the trade-off of the incision is a minor one. Once you heal, you can get treatments to make the scar less noticeable. Here recently, I've been trying out this technology called the Renuvion or J Plasma, and I haven't done it on anyone's arms yet, but I've seen before and after pictures where it shrinks the skin down a pretty significant amount without getting the excision, so you don't have that big scar. Excuse me. So you don't have that big scar running up the inside of your arm. So that's another option that's kind of new. I'm still trying to discover if I buy into that technology or not. What I've seen so far is promising, but the people that I've treated are not far enough out for me to say for sure that it's a go. But for sure, to make the skin go away, you can cut it away. You just have a trade-off of having a scar running up the inside of your arm. Similarly with the thighs, it's kind of the same thing. A lot of times after losing a lot of weight, people will have like redundant skin in their inner thighs, or a lot of times they may have a lot of cellulite on their thighs. It seems like the thighs are like, for a lot of women, that's like the hardest thing. After losing a lot of weight, they might lose weight everywhere, and a lot of times still they'll have a lot of fat still left in their thighs. So with thighs, it tends to be a liposuction and excision type of treatment plan that tends to go down for massive weight loss people. And sometimes, depending on how severe their thighs are, they might end up with the typical incision from a thigh lift, which runs up the inside of your thigh up towards your groin. But then they might even need an incision on the outside of their thigh, depending on what they have going on and what their goals are. It's really hard for ladies or men too, after you've gone through whatever you went through to lose the weight, whether it be diet and exercise alone, or you get a type of bariatric surgery to help you. When you go through, regardless of which method you take, it's still a lot of work and stress and fear and all kind of stuff that goes along with the process of losing weight. And then you lose all the weight and you have all this skin that plagues you. A lot of people who lose a lot of weight will be so miserable with all the excess skin that they're like, I liked myself better when I was heavier because everything was filled out. And so one of the things that people really have to think about is whether or not they'll need plastic surgery to make their body more, what's the phrase I want to use? I'm not going to say normal because they're normal, but to make it more appealing to them, to make them feel more confident in the new body, so that they don't feel insecure about the fact that they have all this excess skin hanging everywhere. A lot of times they're like, I don't want anybody to see me with my clothes off, because they're ashamed of what they look like with their clothes off, because they have so much redundant skin. So those are some of the surgeries that people consider after they lose a lot of weight. I know, Cynthia. She said, these emojis over the comments drive me nuts. I try to keep touching them. I know, girl. That's what I was talking about yesterday. It was driving me crazy. Yes, there's several types of tummy tucks. So there's mini tummy tucks, which is just it's a shorter incision. It's just a horizontal incision. It's shorter. Nothing's done to the belly button. It's just cutting off the excess skin at the bottom and closing. Then there's the full tummy tuck, which is the belly button is relocated, the rectus muscles are repaired, and the excess skin is cut away from the front. Then there's extended tummy tuck, where the incision goes a little bit further toward the back. There's a circumferential body lift, which is a tummy tuck in the front and excess skin removed in the back as well. So you basically have an incision that goes around your entire torso. There's a fleur-de-lis abdominoplasty, which is an incision up and down the midline, and then the lower horizontal incision that's hidden underneath your underwear. I think that's all the tummy tucks. Okay, I'm going back and checking some questions because I was talking but I wasn't looking. I don't know if this is my phone or Facebook tripping. Trying to scroll through the comments and it's like getting stuck. Okay, I answered that one already. Oh, Tiffany, you had gastric bypass. Hey, Monica. Will that help with these hereditary bags under my eyes? They disappear when I smile. But who knows? Me will think I'm crazy. That treatment that I got on my face can't help with bags. That's why I did it to my face, because mine are coming back out. These emojis are getting in my way of your question, Yvonne. Is necrosis always a plastic surgeon's fault? No, it's actually not always a plastic surgeon's fault. Sometimes you can get necrosis if you smoke. You can get necrosis if you are wearing a compression or a waist trainer right after surgery. Sometimes people will go and try to do these non-invasive liposuctions after they've had treatments, trying to make their results worse. That could be an issue. So, no, it's not always the surgeon's fault. But that's why I do these videos, because you have to police your own body. And people will watch my videos and then they'll still go to somebody and let them do liposuction on their abdomen at the same time as their tummy tuck. And then when they get necrosis, they want to blame the surgeon. But if you already know and you still let somebody do it, that's your fault. People be like, well, my surgeon, okay, go ahead. I explained it to you. I drew pictures of the blood supply, all of that stuff to explain so that you understand. And people will be wanting to try to get everything all at once. Well, I just want to go to sleep once. I'm sure you do, but if that's not the safest thing, then that's really not going to work for you now. If that's, you don't want to be trying to take shortcuts with your one and only body. So if you go and do something that you know is wrong because you're trying to take shortcuts, you can't blame the surgeon. You need to blame yourself, because it's your body first. While your belly is necrosed, that surgeon is at home with their family or maybe on the beach showing their belly intact. Like, you got to look out for yourself. Yes, Tommy, you're right. With Sculptra, you definitely want an experienced injector with Sculptra, because you'll end up with a bunch of granulomas and stuff. I think I need to get a facelift. Have gastric bypass, lost 300 pounds. Notice that my neck is kind of loose. Oh, congratulations on your weight loss. Loose skin on the neck. You can get a neck lift. Okay, Yvonne. So you're saying, see your comment below, you just had surgery. Okay, so I'm not anybody's post-op appointment. You need to, and I'm not about to be like telling you to sue nobody or no kind of stuff like that. I'm not this Facebook Live is not a post-op appointment. You need to take that up with the doctor that you had, Yvonne. Right. So, Nakia, you said you had a thigh lift and it left you with a scar that extends from your knee to that's the scar for thigh lift. So, if you have just a little bit of skin at the top of your abdomen, sometimes you can get away with just a horizontal incision at your groin area. But the typical thigh lift, you have an incision that goes from your knee all the way up to your groin. Like, that's how you do a thigh lift. It's like the arm lift. So you have to have a lot going on to justify the scar. So it's not, I don't know what your scar looks like. but the fact that you have a scar is a part of is a part of a thigh lift. You can do things to make the scar look better, but a thigh lift comes with a scar. Yes, Shamika. I suggest people speak with their surgeon. It's not really fair to me. Like people, I give so much away for free, and it's almost disrespectful when you say, I just had surgery last week with so-and-so, and this is happening. What should I do? Like, you went to somebody else. Call them and ask them what you should do. It's just not really, I think people forget that I'm, like, human. It's kind of disrespectful. And I would never, even beyond that, be trying to tell you what to do when I've never seen you before. I don't know what happened. I don't know what stuff looks like. You need to talk to the person who did the work. They know what happened. It's just, I don't want my patients getting advice on what to do with my surgery from somebody else. Like, it's kind of like the surgeon's code of ethics. We don't do that. The only way I do that is if, the surgeon calls me, like, say you're out of town, like your surgeon was out of town, like, if one of my patients from out of town has an issue and they're in a city near one of my colleagues, and I might call and say, will you see her for me? Tell them what I did, tell them what happened, and then they'll be like, sure, and I'll call you and let you know. That type of situation is a situation where I would do that, but other than that, you need to go back to where you went. Hi, you mentioned in another video you don't do lipo and tummy tuck at the same time, but isn't that necessary for an abdominoplasty? No. So liposuction and a tummy tuck are two completely different surgeries. And if you do liposuction of the central abdomen at the same time as the tummy tuck, it increases your risk for necrosis, which is why I don't do it. Some surgeons do it, some surgeons don't. It's kind of one of those things that's sort of controversial, and we're sort of split. Some people are like, no, and some people are like, sure. But what I can tell you is that since I don't do that, I have had 0 instances of necrosis with my tummy tucks. None. Not one person. I just think the risk is too great when, I don't take that risk. So my patients, if they need liposuction and a tummy tuck, they get one first, wait 3 months, depending on which one. If it's the tummy tuck, we'll probably wait longer than 3 months if they get the tummy tuck first. But if they get the lipo first, then I'll do the tummy tuck in about 3 months. And then they have to break it up. And I never get necrosis of my tummy tuck patients that way, ever. I've never had it. When you do that, is more risk with it. And the reason why that is because too much of the blood supply to the skin is compromised when you do both of those surgeries at the same time. Like, it knocks out too much blood supply. So it's like playing Russian roulette. Like, it might work, it might not. But if it doesn't work, it's really bad. So I just don't think it's worth it. So I make my patients wait. Pick one first and we do the other one. Usually I do lipo first. Yeah, somebody lied. Necrosis isn't 100% the surgeon's fault all the time. There's definitely stuff the patient can do to mess up the surgery, which is why it's so important to follow the instructions. Now, I don't know your situation. It could possibly be the surgeon's fault. I don't know. I don't know your situation, but there's almost never finites. There's never always this or always that. Like, it just doesn't work like that. And you can still get, like, I remember a few years back in one of our plastic surgery meetings, they were doing these cases like that were perplexing. And so one of the people who presented, they had a tummy tuck. All they did was the tummy tuck, and she got necrosis of her entire abdomen, and she didn't smoke. She was a healthy size. There was no lipo done. And so sometimes people will have like conditions that we don't know about that make them more vulnerable to certain things. So it's just never when people try to oversimplify things, it's kind of dangerous. That's why training to become a doctor and to become a plastic surgeon is so long, because there's so much to it. It's not, you can't, Like, I share a lot of information, but the stuff that I share with y'all is basic. It's basic. It doesn't seem basic to you because you don't know about any of it, but it's very basic stuff. And I have to oversimplify a lot of things to make it so that people understand, because there's a lot of layers to stuff. Like, it's not that simple. So even if the doctor can technically do everything by the book and you still have an issue, usually that doesn't happen with necrosis, usually, but there's smoking, diabetes, if you have some sort of vascular disease, all those things can make you get necrosis. And patients definitely sneak and smoke. They'll be like, I don't smoke, I'm not going to smoke, or they'll quit for the surgery. But once the surgery's over, you can start smoking and there's nothing I can do about it. And you can just tear up your surgery like that. And smoking and tummy tucks does not mix. Or if you go and try to put on a waist trainer because you're trying to make your waist go in further, or wear garments that's way, way too tight in the immediate post-op period, that'll kill your skin because it's already vulnerable. So it's not 100% the surgeon's fault for sure. That's definitely not true. Ugh, I'm trying to scroll and the thing won't let me scroll. Okay. I was laughing at your comment, Lori. Can you do a tummy tuck on a bigger person that only lose about 50 pounds? I won't do a tummy tuck on anybody whose BMI is over 35. Janicia, you said you weigh 224. How much do you need to lose for a tummy tuck? It depends on how tall you are. So your BMI for me needs to be 35 or less for a tummy tuck. Come on, Tara. I could do your tummy tuck, honey. The arm skin, the arm recovery, sometimes the arm recovery is a little annoying if your incision goes into your armpit, because it's hard to keep that dark, moist place from the incision from breaking down. So sometimes it's a little bit of an issue with the incision if your incision goes like into your armpit at all. But the other thing is trying to control the swelling, and you have to wear sleeves, and it's kind of annoying. But once you get out of the first couple of weeks, it's cool. I do the skin consultation. Well, my skin consultations is a combo between me and my esthetician. We both, unless it's a virtual one, and then it's just me. But if it's in the office, you first meet with my esthetician for the first half of the consult, and then after she does your mini facial and gets your skin clean and stuff, and then I come in. Thank you, Danielle. Danielle, are you coming to the Epic conference? Because you were all up on that Facebook Live. Oh, good question, Stephanie Hart Ellis. So she said, so no lipo during tummy tuck. Does that include lipo to the flanks? So you can get lipo during the tummy tuck, just not to I just won't do it to central abdomen. So I will do your flanks. I'll do your sides. Sometimes I'll do liposuction of their whole back and sides and then flip them over and then do the tummy tuck. You can get lipo, just not on the central abdomen. I won't do it. So definitely you can get lipo at the same time as the tummy tuck. It's just where you get it that's important. Yes, the tummy tuck and arm lift can be done at the same time. Okay, my Facebook ain't letting me scroll with you. Okay, let's see. What's the difference between tummy tuck and a paniculectomy? Good question. So a paniculectomy is almost like it's along the same lines as a mini in that your belly button is usually not moved. The textbook paniculectomy, Like the way the surgery is described in our books, our plastic surgery books, is nothing's done to your belly button. The apron is just cut off and then we just close it. So people have been doing, some plastic surgeons will be like, oh, I'll move your belly button and I'll do this and I'll do that. That's not technically part of a real this textbook paniculectomy. And with the paniculectomy, the muscles are not repaired. The second you repair the muscles with a paniculectomy, is considered a tummy tuck. That is a major thing because that's what makes your belly look flat. So when people get a paniculectomy and just cut off the part that's hanging at the bottom and they don't do anything for the rest of their abdomen, they end up looking round like Humpty Dumpty. So a paniculectomy is not a tummy tuck. Thanks, Pebbles. Yeah, okay, so Yvonne said, he's been amazing to me with me treating me, but someone in the wound group told me it's always a doc fault, which I never heard. Yeah, see, that's why I hate those groups. Like, those groups are good and bad because you have the blind leading the blind. And so people will say stuff like that when they don't know what they're talking about. They don't even understand what's going on. Even people will watch my videos and think they're an expert. You're not an expert. It takes a long time to learn all of this stuff. Like, when I tell you that I'm telling y'all the surface, like, I'm telling you the surface. You can't Google or YouTube and sit up in those groups and think that you know everything. And people think they know everything because they had a complication or they had a surgery. Like, that is so ridiculous. It is not always the surgeon's fault that you got necrosis. That's not true. That's not true. Sometimes it is the surgeon's fault, but it's not always the surgeon's fault because patients definitely do stuff to ruin surgeries, which is why I'm like so hands-on with my patients after surgery, especially big surgeries like tummy tucks. They see me all the time. I don't give them a chance to mess up my operation. They are in my office. Got them following up all the time so I can cut stuff off at the pass when I see something not going right. I'm glad your doctor's been there for you because that's major. Like, complications happen. Like, every surgeon gets complications. And the important thing is that your doctor is there to take care of you and see you through it. It's not your doctors aren't God, and there's no way to predict if a person's going to get a complication or not. But the only time that I have issue with it is when the patients get abandoned after they have a complication. So as long as your doctor is seeing you, taking care of you, and getting you through it, that's fine. Like, complications happen. It's cool, Yvonne. I'm like, I'm just kind of sensitive to that because I feel like, I take my time and I sit and do these videos to teach people, to help them make good decisions for themselves beforehand. And I don't expect everybody to come to me. I don't, but I think sometimes people just, and I'm not saying that's what you were trying to do at all. So I apologize because I know I get short with people. This is just kind of like one of those things that it happens a lot and it gets under my skin. I'm like, people just, I just give, and people act like, I owe them more. Because none of y'all surgeons is sitting on here doing this. Like, none of them. No one does this. Like, I'm the only one who sits and tries to teach so that people can make safe decisions for themselves regardless of who they go to. So I just don't think it's fair when you're like, I just had my surgery by so-and-so last week and this is happening and what should I do? Like, watch one of my other videos when I talked about this. That's how I feel. Like, it's just kind of like too much. But we're good, girl. I appreciate you supporting me and watching my videos, and everything will be fine. And just keep listening to your surgeon, and you'll get through it, and it'll be all good. Complications happen. It's not the end of the world. And you sounds like you got a good surgeon because they're looking out for you and seeing you through it. Hold on, my finger getting stuck again. Maybe I need a new phone. I got the iPhone 7. I ain't get the 8 or the 10. So Apple is probably making my phone not work. Because I can't scroll through the comments. They're like frozen. Okay. Yes, Michelle, that's a good point you made. You said you had a tummy tuck 2 years ago, and now you've been exercising and you can see the full results. That is the truth. So if you get surgery and you take care of it and you exercise and keep your weight in a good place, it'll make your results even better. Like one of my patients, she after she got her tummy tuck, she actually got a mommy makeover. She started like strength training and meal prepping and stuff, and she looked so good 6 months after her tummy tuck. I was like, girl, that's not how I left you looking. You look way better than what I did. She looked so freaking good. But once she healed from the surgery, she started going hard in the gym and with her diet, and she looks phenomenal. Phenomenal. What are the surgeon assistant's duties? The surgical, if it's a first assist, they can sew, so they can help close, and they might even do boving and stuff like that. They assist the surgeon. They shouldn't be doing the surgery. Like the surgeon should be in there with them when they're working, and they shouldn't be like doing the surgery while the surgeon's somewhere else. That's inappropriate. I allow my patients to like do light exercise, like walking and light aerobics after 3 weeks, as long as their incisions are all doing good. And then core exercises after a tummy tuck, I won't let them do for 6 weeks. If you gain weight and get back on track and lose, would your results from the tummy tuck come back? Usually. Now, if you have skin that is naturally lax, gaining and losing weight can mess up your result. If you have good skin quality, then it should be fine. And it also depends on how much weight you gain and lose. So if you go put on 50 pounds, that will be an issue. I want lipo, but I got loose skin, but I don't have kids, so how am I gonna do a tummy tuck? You can have a tummy tuck without having kids if you got skin hanging still, so. I usually do the tummy tuck first with a person who gets lipo and, not the tummy tuck, I'm sorry. I usually do the liposuction first if a person needs both lipo and a tummy tuck, but not always. It depends. But usually I do the lipo first. If you get pregnant after a tummy tuck, you get pregnant after a tummy tuck. You might need another one. Not so much for the muscle repair, but it depends on what kind of suture the surgeon uses to repair it. The muscle repair will probably hold up if they use a permanent suture. But your skin might get messed up again. A recovery house is a place that people go to after they have surgery when they travel to a surgeon. And people set up these houses and they'll help you recover, basically, instead of staying in a hotel by yourself. That's good, Yvonne. Yeah, it sounds like you got a good doctor. Yeah, Yvonne, just like those surgery groups, just remember the source and just remember it takes so many years to become a doctor and even more than that to become a plastic surgeon. So don't let people oversimplify really complex things. Sometimes the stuff I read in those groups, I'm like, oh my God. It's scary, some of the stuff that people say, and then the other girls just believe it. Thank you, Kim. So this is bad. So she said I look amazing after having my sweet baby girl. So when I got pregnant, I weighed 185 pounds. And when I took the pregnancy test, I was 185. The morning I delivered her, before she was born, I was 185. I gained 0 pounds during my pregnancy. 2 weeks after she was born, I was down to 164. So I was 21 pounds under my pre-pregnancy weight 2 weeks after she was born. My butt with a trainer, now it's not my trainer's fault because my butt, I'm just bad with, like, I am weak with food. I suck. Like, I like cheesesteaks and fried chicken and stuff. Like, it's so bad. And I've been working out with my trainer 3 days a week. The days that I work out, I'll be good with my food. But the next day, like, I am reckless. And sometimes I'm reckless that night. Like, I'll be good during the day because I'm thinking about how he kicked my tail that morning before I got my day started. But by 8 o'clock at night, I might be eating a cheesesteak or a Big Mac. And then I went to Dominican Republic last week, and the resort I stayed at, the food was not good. The only thing they made good was like French fries. So I basically ate French fries for 5 days. And so basically now I'm 5 pounds over my pre-pregnancy weight. So thank you for telling me I look good. I didn't gain all of this weight. I gained all of the weight back, and 5 extra pounds. It was so bad. Hey, Yvonne. Okay, so this is like my mom. You're my girl now. It's like a rite of passage. I like you and I appreciate you being here, and I'm glad you stayed on. I wasn't trying to chop nobody up, but you took one for the team because I've never really got into it like that with anybody, but people do this to me every single time, and it just gets under my skin. And I just, I guess today I couldn't take it, but you my girl. I'm going to be looking for you on all of my videos now. And I appreciate you not running off and talking cash money about me after the thing was over. Like, she said this and she said that. And I hope you won't be afraid to speak in the future. And I'm going to pray for you tonight that your recovery from here forward goes smoothly and you heal up and get to enjoy your surgery ultimately. A lot of times when people get necrosis, unless they get a whole bunch of it, once everything heals up, it might be months that you're nursing the wound or whatever. Once everything heals up, they still can enjoy the results. Like, you still have a better shape, your belly's flat, all that kind of stuff. So just, focus on the outcome and not what's happening right now, and everything will be okay. All right. So I'm going to go ahead on and get off, y'all. I got 2 surgeries in the morning. I got to get these kids out of here early. So I'm going to go ahead on and get myself ready for bed. So thank you all for coming on with me. If you didn't share the video, share it now. Yvonne Wilson, you my girl. Thank you for engaging on my Facebook Live. And I hope I see you on the next one. And if you want to reach me, you can reach me via my website at www.ederabella.com, or you can call my office at 678-325-0006. Oh, what'd you say? My 100% granulation tissue, and I saved my fat, so I'm happy. Not a full loss. Good. That's good. It's gonna be good. It's gonna be fine, girl. You're gonna still be strutting along in a swimsuit and looking good in your outfits once everything all heals up. It'll be fine. Eat a lot of protein, girl, so your body can heal up even faster. All right, I will talk to y'all probably next week, because tomorrow Friday, maybe Sunday. I might do something on Sunday, or maybe not, because Monday is the first day of school. Yeah, y'all will probably hear from me on Monday. Alrighty, bye.